Hi everyone. This is the part 4 and continuation of the summary of your blood test results and what it translates to. And this is basically the last part. Just a reminder that anything I post here is not meant to diagnose or cure anything and is for informational use only. For any health-related matters, please ensure to consult your healthcare provider. So next in line comes the hormonal level readings. The hormones like free T3, T4, TSH, FSH, and LH come from two different but sometimes interconnected endocrine systems, the thyroid and the reproductive system. And here's how sort of they all tie together when you're reading the blood test results. So the thyroid axis, or TSH, free T4 and free T3. TSH, or thyroid stimulating hormone, the normal range is between 0.32 to 4.00. TSH is the boss of the thyroid system. It is produced by the pituitary gland in the brain, and TSH's job is to tell the thyroid gland to produce and release thyroid hormone. T4, or thyroxine, normal range is 9.0 to 19. This is the main hormone the thyroid gland produces. Think of it as inactive or storage form of thyroid hormone. A blood test for T4 often measures free T4, which is the amount of T4 not bound to proteins in the blood and is available for your body to use. Then we have free T3, or triiodothyronine. Normal range is 2.6 to 5.8. This is the active form of thyroid hormone. And most of the T3 in the body is converted from T4 in the tissue, like the liver and kidneys. Free T3 is what actually affects your cells and regulates your metabolism and your heart rate, body temperature, and more. So the relationship between these three is often opposite. If your thyroid gland is underactive or hypothyroidism, it doesn't produce enough T4 and T3. Your pituitary gland senses this level and tries to compensate by releasing more TSH. So a classic pattern for hypothyroidism is high TSH, low free T4 and free T3. If your thyroid gland is overactive or hyperthyroidism, it produces too much T4 and T3. Your pituitary gland senses this high level and releases less TSH to try and slow the thyroid down. A classic pattern of hyperthyroidism is low TSH and high free T4 and T3. So TSH is often the first test a doctor will sort of order because it's the most sensitive indicator of a thyroid problem. If it is abnormal, they will then check free T4 and free T3 to pinpoint a specific issue. Then we have the reproductive axis, or FSH and LH. FSH and LH are part of a separate but equally important feedback loop that controls reproductive function. So FSH, or follicle stimulating hormone, normal range is 16.7 to 113.6, and this is produced by pituitary gland. FSH stimulates the growth of follicles in the ovaries of women and sperm production in the testes of men. Then we have LH, or luteinizing hormone, and the normal range for that is 10.9 to 58.6. Also produced by pituitary gland, LH triggers ovulation in women and stimulates the production of testosterone in men. So in women, during the menstrual cycle, a rise in FSH stimulates the growth of a follicle. As the follicle sort of matures, it produces estrogen, which causes a surge in LH. This LH surge triggers ovulation, and after ovulation, FSH and LH levels generally sort of drop. In men, FSH stimulates sperm production, and LH prompts the testicles to produce testosterone. While they are separate systems, there is a connection between thyroid hormones and reproductive hormones. The crosstalk between these two systems is why a thyroid imbalance can sometimes cause reproductive issues. So hypothyroidism, high TSH, low T4, T3, can disrupt the menstrual cycle, and lead to infertility in women. This is because high TSH can sometimes lead to an increase in another pituitary hormone called prolactin, which can interfere with the production of FSH and LH. Hyperthyroidism, or low TSH, high T4, T3, can also affect the menstrual cycle and cause infertility. In summary, when you look at the blood test results with all these hormones, you should generally interpret them in pairs or groups. TSH, free T4, free T3 are all directly related to your thyroid function and metabolism. FSH and LH are directly related to the reproductive health. However, a doctor will consider the results of both groups together, especially if you're experiencing symptoms related to both metabolism or reproduction, because the problem in one system can impact the other one. Then we have, in the chart of readings, we have BNP. Normal range for this is less than 100, or brain natriuretic peptide, BNP. BNP levels are simple and objective measures of cardiac function. These measurements can be used to diagnose heart failure, including diastolic dysfunction. High BNP levels generally indicates that the heart is under stress and could suggest heart failure, while low levels are often normal and may indicate the absence of heart failure. Another form of BNP is NT-proBNP, is also used to assess heart failure. Normal levels are generally below 125 picograms per milliliter for those under 75 years of age, and below 450 picograms per milliliter for those over 75. So hope this has been helpful. Like and follow for more. Be the light.